So in this video clip, I'm going to talk about the different types of eating disorders. So first we have anorexia nervosa, and it's characterized by self-starvation or a very low food calorie intake. Now, it leads to a significantly low body weight. They used to have as a diagnostic criteria less than 85% of expected body weight, but at the beginning stages of anorexia, you can start out as overweight. Still, you have anorexia nervosa, but it takes a while to get down to that, what we used to have as a diagnostic criteria, or that very low body weight. So you can actually miss a diagnosis if you assume that they have to be very, very thin, because a lot of times anorexia nervosa starts when a person's somewhat overweight. There's also an intense fear of gaining weight, even when they're underweight, and a body image disturbance where they see themselves as bigger than they actually are. So this is a picture of someone with anorexia. You can see the malnutrition, the wasting of the muscles, the depleted body fat, the protruding bones, and things like that. Some people think of anorexia as two subtypes, one where they just restrict, and let's see, I have worked with a lot of people with eating disorders, and they sometimes have really interesting food rituals. I knew someone who would only eat foods that were blue. Well, think about, there aren't many blue foods, so that eliminates a lot of foods. But if she ate something, she would put blue food coloring in it. I know people who would only eat an apple a day, and that's all they would eat, or only carrots. I knew somebody who had, she was an anorexic who would actually purge as well. So she was I don't know if she binged, but she did purge. But she ate a ton of carrots because they help you feel full. Because they have a lot of fiber, and she actually turned orange. When you eat a lot of beta carotene, which is in carrots, the skin can actually turn an orange hue. So there's the restricting type, and there are some people with anorexia who will occasionally binge and purge, or purge when they do eat. So a lot of people with anorexia have what we call comorbid conditions, or things that occur along with the anorexia, like mood disorders like anxiety issues, depression, personality disorders. It was really interesting when I pulled this PowerPoint up from the one I originally created years ago. All of the pictures of the people with eating disorders were female. And so I changed some of the pictures to include males, because I'm seeing more and more men with eating disorders. In fact, one of my former students, who's a dietitian, very successful dietitian in private practice in Colorado, her husband is in recovery from an eating disorder. He's a distance runner, which is an at-risk group for eating disorders. So for people with anorexia, their sense of worth is contingent on their weight. They tend to weigh themselves multiple times a day, and they're really unhappy. They get a high. One of my patients said that she got a high whenever she saw the number on the scale declining, and once she got through a day without eating, she had this sense of accomplishment. They tend to be people pleasers, need a lot of structure, tend to be perfectionists. They tend to be kind of quiet and withdrawn, more of the introverted type, low self-esteem. And some things that I've noticed, they tend to have really, really neat handwriting, and small handwriting. There's a lot of control that seems to be associated with anorexia. They have an intense fear of gaining weight. In fact, one of my patients started gaining weight. She was in inpatient treatment. She got out and she was doing pretty well, but she started gaining weight when she had always been able to control her weight. So that really bothered her. And so to cope with that, that anxiety about gaining weight, the doctor prescribed her benzodiazepines, Xanax, and which is a tranquilizer. Well, then she started abusing the Xanax, and then that spread to alcohol and oxy. And so she became a full-blown drug addict and ended up on Dr. Phil, actually. Turns out, she'd always been able to control her weight, and she couldn't. And so she turned to drugs. And that happens a lot of times. People who have one type of addictive behavior, and, eating disorders are very similar to kind of an addictive personality. They develop other addictions, as they're prone to other addictions as well. But anyway, turns out she went to a dietitian, and the dietitian noticed the signs of thyroid disease. And it turns out she had hypothyroidism, and that's why she couldn't control her weight for the first time in her life. So a lot of eating disorders, including anorexia, begin with a first attempt at dieting. That's why, as a dietitian, I have a really hard time with putting kids and teens on weight loss diets. I'm fine with improving eating habits and overall lifestyle with increased activity, but when the focus is on weight loss, I get really scared. About a third of anorexics have a history of being slightly overweight before they developed the condition. But even when they're extremely thin, their fear of gaining weight doesn't diminish and may get worse. When you start losing weight, and I can tell you this is, someone who was, very, very overweight, you get all sorts of compliments when you start losing weight. And that's one of the sustaining factors for anorexia, and the attention that they get. A lot of them have a body image disturbance where they don't see themselves as thin as they actually are. So these are some of the complications of anorexia, and it's kind of hard to see, so I'll try to go a little bit closer. It does affect the brain and the nerves. One person I know who's had problems with anorexia since she was 6 years old, and now she's in her mid-30s. She knows she doesn't think correctly. She knows it's affected her brain, and they have seen in autopsies smaller brain volumes in people with anorexia. Does change the brain chemistry, which may actually reinforce the eating disorder. They start losing their hair, it becomes thin and brittle, and it kind of loses its color as well. Low blood pressure, irregular heartbeat. The same person I was talking about a little bit earlier, just now, she actually had she had a heart attack at age 26 because of the electrolyte imbalance that occurred. And at risk for heart failure because of the extreme malnutrition. Anemia, wasted, weak muscles, osteoporosis. I've seen that over and over and over again in, women in their 20s with anorexia. They have the bones of an 80-year-old. Kidney failure, I've seen that occur in people with anorexia nervosa. The electrolyte imbalance that can actually, kill a person. The digestive tract, slows down, and there's a lot of constipation. A lot of people with anorexia, just to see the number on the scale get lower because that gives them a high, will dehydrate themselves, which can compound the constipation in addition to the not eating enough food. Hormone imbalances, infertility, low estrogen, And in the skin, the interesting one is the fine hair, which is all over the body, which is called lanugo. It looks like baby hair, kind of furry. You can see it on their neck and face, but it's all over their body. They're cold all the time because their metabolic rate slows down as an adaptation to the starvation. I'm going to stop this right here right now. It's getting darker. I have my blinds open, and so it's harder to see the slides. So I'll continue with, I think, bulimia in the next clip.